Good afternoon, everyone. My name is Matt Lawrence. I'm a director with PwC's Life Sciences practice. I drive our operational and supply chain team. I've got a little over 25 years of supply chain operational excellence experience, and most recently I've been working with Abu Dhabi, the Department of Health here in Abu Dhabi on the life science sector strategy. In today's session, we're going to talk a little bit about supply chain. There's been some significant progress in the recent years here in the Gulf around public-private partnerships and really how to leverage those relationships to really bolster the supply chain capabilities to ensure that we've got an effective and efficient supply chain capability to deliver to the healthcare, deliver the healthcare system that's required. Today I'm going to be joined by 4 experts. They're going to bring deep insights and best practices around not only public and private partnerships, but some of the best practices that we can bring forward here to really, again, strengthen the partnership. With that, I'll bring up my 4 experts here. Before we get started in on some of the questions here, we'll go through some brief introductions here so the audience has a sense of who's with us today. Over to you, Minister.
Adonis Georgiadis, the Minister of Health of Greece.
Great, thank you. Tala?
Tala Al-Ramahi, Chief Strategy Officer for Reaching the Last Mile.
Great. Mr. Sultan?
I'm Awayed Al-Harthi, the CEO of Al-Aliyan Holding Group.
Tarek Sultan, Chairman of Agility.
Great, thanks for that. All right, so we'll dive into some of the key questions we have here. So first, Minister, with PPP in mind and reflecting on, how you've really leveraged those setups to drive patient access in Greece, could you share your thoughts on how fundamental public-private partnerships have been to this?
First of all, thank you for the invitation. It's a great honor for me participating to Healthcare Week here in Abu Dhabi. I always want to refer to this marvelous country and the progress this country has done in the recent decades, a country that everybody should admire. So I'm very, very honored and very happy being here. I'm sure you have heard some of our recent stories that Greece passed through a very difficult decade of financial problems. We were almost bankrupt, and during this period we faced tremendous challenges in our health sector since our budget was very limited and the healthcare needs were going sky high. And one of the first problems we had to deal with was the way we would provide access to the uninsured people, because during the financial problems period, a lot of people lost their insurance capability, and with that, their access to our healthcare system. So Greece followed a road of universal coverage of all our population in healthcare services. In order to achieve that, we did a lot of reforms, and a lot of these reforms came with PPPs, with private and public partnerships, in order to find ways to use private sector's abilities and public infrastructure in a more efficient way. And now, as we speak, my main task as Minister of Health of Greece is to find a way, in all the reforms we recently voted to our parliament, is how we'll find a way to make the private and the public sector collaborate as closer and as much as we can. We believe in this kind of model. You know that in the health sector globally, not only in Greece, the future is very challenging. Our population in the Western world is aging. The healthcare needs are increasing by that. The new pharmaceutical discoveries and the new therapies that are very welcome because they are saving thousands of lives, they're very expensive. So we have to find a way to use our budget in a very more wise way in order to produce the fiscal space to be able to stand the burden. And in this way, private and public partnership maybe will be the solution, because it will help the state to save money and produce better healthcare services. This is the main idea.
And I mean, very helpful and appreciate those insights. I mean, from your perspective, I mean, what more could be done from a private sector or from a public sector perspective to really energize and strengthen these relationships for long-term success?
I think I will speak about Greece. Now we're finishing all this huge program of the medical record of all our patients, and we will have in our hands a huge mega data about everything around our healthcare condition. So with the private sector, we will be able to implement policies in a much more specific way and in any patient or in any region that will help to cover their needs in a much more effective way and by saving money also at the same time.
Great. Okay. And any closing comments or key learnings that you've had from your side that we could share with the audience here that would,
My main message, even though here in the UAE they know because we have a very good friendship and we do a lot of things together, Greece is back. And one of the fields that proves that Greece is back is the health sector. And I think a lot of reforms that we have done in the recent years would be very interesting for you also.
Great. Thank you very much
Thank
for
you.
that. Appreciate it. Tal, over to you then. So, we've learned how PPPs are really being deployed effectively to solve bottlenecks from a supply chain and operational perspective. I mean, what complementary role can philanthropy play to this partnership model? And particularly when it comes to being, enabling more equitable access to healthcare and population and LMICs.
Thank you very much, Matt, for this question. It was quite inspiring listening to His Excellency speak about Greece's experience on implementing universal health coverage. As a philanthropy that invests in global health, one of the things that we are very acutely aware of is it will be very difficult to achieve universal health for everyone, everywhere. And I think that's where philanthropy has such a critical role to play, especially where there are no market incentives from the private sector to come in and provide the health services needed for sometimes the most remote and underprivileged communities around the world. So put simply, for us, global health should be a global concern. You still have billions of people around the world that cannot afford to pay for healthcare, and unfortunately, for some countries, these countries either cannot afford to provide the health services to these people, or just are not prioritizing this within their own health agendas. And this is where really the philanthropy can play a critical role in addressing these system gaps and ensuring that we're achieving health equity through investing in inclusive supply chains that reach everyone. I'll give a few specific examples when it comes to philanthropy and from our experience investing in global health worldwide. For those of you who might not know, Reaching the Last Mile is a portfolio of global health programs and investments funded by His Highness the President of the UAE. Our investments over the last decade have focused on ending infectious preventable diseases, ensuring we reach elimination goals for diseases that are within the last mile of elimination or eradication. This includes diseases such as polio, neglected tropical diseases, and malaria. And I think for us, as we think about advancing global health gains and disease elimination, we cannot achieve disease elimination without thinking about innovation. Innovation is often spearheaded within the private sector, and unfortunately, sometimes because of market incentives, these innovations only serve the communities and markets that are able to pay for it. What philanthropy can do is ensure that these innovations reach to communities that are unable to pay for these innovations, but also ensure that these innovations are adopted for the communities and for the circumstances of where these innovations can be adopted for the right causes and needs within these communities. Here in Abu Dhabi, we have Hub 71, which is an entrepreneurship hub that is really creating market incentives for entrepreneurs to set up shop in Abu Dhabi. Many of these SMEs are driving a lot of the diversification needs of both the local economy, but also some global markets as well. And what we've been able to see is there are immense opportunities for philanthropy to work very closely with entrepreneurs that are set up in Hub 71 and ensure that the innovations that they are creating are able to be adopted for communities that we're serving. And then second, I think within global health, when we talk about supply chains in low and middle income communities, often these supply chains are under-resourced, they're weak, they're vulnerable, and often fail to incorporate last mile communities. And again, when we talk about disease elimination and even learnings from the COVID-19 pandemic, we know that systems or gaps in health systems anywhere are a threat to everyone, everywhere. And that is why it is imperative for us to continue to ensure that we are reaching every last community. Often these communities are quite remote. Often these communities are communities that are the least able to access health services, least able to pay for these health services. And within our portfolio, for example, through His Highness's commitment to help eradicate polio virus, for those who are not aware, polio is currently endemic in only 2 countries around the world, Pakistan and Afghanistan. His Highness has invested significant amount of funding towards reaching eradication of that disease in Pakistan. And the only way that we can do this, the only way that we can make sure that polio is not a threat to anyone globally, is to ensure that we're reaching these communities that are often hard to reach, often in areas where security is of a huge concern. And so for many parts of the regions that we serve through the Emirates Polio Campaign, we rely on frontline health workers. Often these frontline health workers remain the backbone serving the most underserved communities. And with the experience of polio in Pakistan, over 103,000 frontline healthcare workers remain the last link of that supply chain to reach these communities. I'll stop there, and I know there are a few other speakers on this panel
thanks for that,
to give them
very, very
that
helpful.
opportunity.
All right, so we're switching over. Mr. Sultan, over to you then. Obviously, you've got significant experience in supply chain and logistics. Maybe you could just talk a little bit about the life sciences supply chain and why it's so critical and some of the challenges associated with it.
So thank you for that. So first of all, our company is a company that does business in about 120 countries. We're in almost all major ports, airports. But even with that scale, it's not enough to actually meet the requirements of the global health crisis. So this need to be everywhere and everywhere at any given time is something that's a really daunting task, especially given the physical infrastructure constraints that you have in many countries. So I think that part is obvious to I think everybody. But sometimes also politics and policies get involved in actually making the supply chain difficult. So we spent 50 years in the economic sphere trying to actually focus economically on areas where we have a comparative advantage. And during COVID, all of a sudden, we had governments putting up barriers and basically not enabling free flow of goods when they were needed. So obviously, that's going to create a major disruption to your supply chain because the goods cannot flow and you're not able to produce them where you need them. In a similar fashion, if you look at the way that the fiscal stimulus worked during COVID, we were not able to get enough containers to ship goods around the world because there was so much consumption being done, primarily in the Western countries, that we were not able to actually get goods shipped. So here's a supply chain issue that's being caused by policy, and I think that's sometimes lost on this matter. I guess the issue of health equity and income constraints is also a very critical one, because obviously the cost of delivering some of the technologies and solutions that have been developed for the West are not really relevant to where these solutions are needed around the world. So that's something that makes it challenging, especially when the cost of, you introduce the complexity of temperature control into that dynamic, it becomes much more challenging. I would also say the pace of change in regulation and technology is highly disruptive, and that is in itself creating, I think, an unwillingness with companies to hold enough stock sometimes to meet the demands of their customers, because the pace of change is sometimes putting their goods and services out of business. I'll give you a couple of examples. We have a startup that we invested in that can do a COVID test with an eye selfie. It can measure your blood cholesterol. It can measure your blood pressure. It can measure your pulse O2. So think of all the different devices that are basically disrupted by that technology, and you can start thinking, you can start imagining why companies are kind of holding back their inventory and minimizing the amount of inventory they hold in stock. I think so. In reality, that's kind of the issues. And again, one other example is a U.S. company that makes this device the size of a computer mouse that detects breast cancer. There's no infrastructure needed in a hospital. There's none of this big sort of scary stuff that the women have to go to. This sort of technology just needs a lot of examiners to actually roll it out. That's disruptive, and that's why it's challenging to actually disrupt. So we'll leave it at that. Thank you.
Great. Maybe I just one following question. I mean, what do you see as some of the key drivers for all these public-private partnerships within the Gulf, and what do you see as some of the keys for success?
So, in the Gulf, let's talk. In the world, there's always been a need for PPP, but I think what you're seeing in the Gulf is that now there's an ecosystem that can actually manage and handle the volume of incoming PPP. If you just look in Abu Dhabi, for example, if you look at how well articulated the strategy is around engaging with technology providers, with investors, et cetera, there's a home for PPP to have a discussion. So I think that's one area that's really driving the pace of change, because in the past you could only, for example, have a discussion with the Ministry of Health, and they were already pressed with what they could do and not do. So having the ecosystem is actually accelerating the pace of PPP. I think that's important to keep in mind. We see similar sort of structures in the Kingdom of Saudi Arabia as well, which is driving opportunity for partnerships. I think it's also very important to recognize that the government here is the payer of last resort, and it cares about its citizens. So when the government pays and cares, there's a real opportunity to actually focus on technologies that cut healthcare costs. Whereas in many parts of the West, you would be in a competitive dynamic where you're kind of fighting entrenched industry. You have now the government on your side in an environment where you can disrupt and to get the support of the government to help to disrupt. So that is obviously makes this a great environment to be focused on. I would say also the focus on early prevention, which we heard about today, again, is just driving that dynamic. The entire medical industry has been created on treating disease. And now all of a sudden we are asking ourselves, how do we actually prevent? And that is exciting to be part of, because that gives an opportunity for disruptors to come to play. The last part I would say is that there's always inertia in the medical system. Doctors are the most difficult. I'm not a doctor, but they're very difficult to actually change their opinions on certain things. So having a PPP is actually important to change management. It helps have a focused, a public forum in which to actually change the way behavior in the medical system works, which is a good thing. Thank you.
Thanks very much. Really appreciate the insights. And then lastly, over to you, Mr. Al-Harathi. Question about best practices. I mean, what best practices can we bring in from other industries or other sectors into the life science supply chain to really drive that innovation, efficiency for healthcare delivery?
Well, healthcare is no different from other industry. Actually, it's more complicated and regulated and restricted, and this is make it even very challenging to make it cost-effective and accessible to everyone. And if we would like really to see how can we share best practices, first of all, we have to think as human when it comes to healthcare of people and their needs to access the healthcare system. And some of the company in other industry, when they have a patent that has a big impact on people, they donate it for public. So anybody can use it and it would be available in the public domain so they can start producing this medicine and they don't try to take control of it to make money for the research that they are spending. And some of the government, they are incentivizing those people by giving them tax waivers. Also in other industry, if they have a big challenge, usually they make joint research where they collect people from different companies with clear agreement to tackle this challenge, which is a risk for environment or for people or whatever. And also there is something which is very important if we share our production facilities. And instead of having vaccine system in every region, maybe every company will have a vaccine in one region, but they are sharing the production facility based on certain schedule. Also, some of the company, they are using data analysis and data science, and they share it together, especially to track the inventory. Where there is a need, they can deploy this product to the people in need, and they can reclaim their money from somewhere else. So there is so many idea to enhance our healthcare system, and one of it is having a technical forum like this, what we have in Abu Dhabi, and having the leaders and the government and the policy makers available will help the industry to bring new idea and new innovation that will help the people to enjoy the access to a very affordable healthcare. Because there is diversity, and in some places like in Africa, they don't have cold storage, and they don't have even road to get that. And maybe the technology will be the solution, like the drone or support from some of the big companies that they should put part of their income to support these poor countries.
Great. And I guess just a follow-on question, are there what new strategies will we have to develop as a result of some of these best practices, or being able to bring those in? Are there any significant changes we're going to have to think through?
Well, I think nowadays everybody is talking about collaborative leadership. And without a collaborative leadership, we cannot make much progress. This is not only in healthcare, in everything. And now the new leadership that we are having, and they are having big impact in the world, they are thinking with open mind, how can we collaborate together? There is nothing is called competition. There is something called common success, and together we can do more. So I think the real strategy of healthcare nowadays should focus on one big theme, collaborative and technology deployment. Because now if you see the technology, either the artificial intelligence or the genetic sequencing or biotech or whatever, all of it is technology based. And this technology base, if we do the collaboration and we work together as one entity for the best interest of humanity, of course we'll not ignore the economic side, and the government, they can play big role there, then we can make big acceleration in developing our healthcare system, and we make it much accessible for people in need. And this is need a full collaborative between all the stakeholders, patient, government, education, research center, everyone, just name it. And I think this is what we are trying to see, and this is what Abu Dhabi government is trying to do today by collecting us, talking about the investment, bringing the funds, bringing the big companies in the region and in the globe. And I think this is the best strategy, because every time there will be a new development, a new disease, a new pandemic, and that's why we start seeing in most of the country, they say, we have to do local manufacturing, because during big pandemic or geopolitics, maybe you don't have access to global product from somewhere else. So this is very important, and I think Abu Dhabi and Saudi Arabia, they are working on national health security strategy. So I think every country will do the same, but this will give you the access to the basic. But when it's come to the advanced, then you need different technology, and maybe the telemedicine is one of them that can help you even during crisis.
Great.
Thank you.
Great, thanks for that. Really appreciate it. And thanks again for your time today and providing these valuable insights here around the importance of public-private partnerships and really how through these relationships we can bolster the supply chain here, not only within the UAE, but more broadly on a global basis. So thanks again for today, and really appreciate all the efforts here. Thank you.